These videos have been developed for instructional purposes. For this reason, the nursing students and nursing instructor review the steps of the skills at the bedside. In actual nursing practice, you and your instructor should decide if this approach is appropriate for you.
You missed a spot. I'm sorry. Just so used to cleaning up after my kids. Guess I can cross over sometimes. You need some help? No, I'm done.
What?
Good morning, everybody.
Good morning. Good morning.
Today I'd like to focus a little bit on care related to central venous access devices. Now, what types of CVADs are there?
Well, there are peripherally inserted central catheters known as PICCs.
Non-tunnel percutaneous central venous catheters.
And tunneled central venous catheters.
Right, and implanted ports. Where does the distal end of the catheter sit after it's inserted? Come on, you guys know this. It sits in the superior vena cava, just above the right atrium. The placement is checked after insertion by X-ray before the devices can be used. Now, with these devices, we should intermittently flush with saline and or heparin. Why is that?
Doesn't that prevent clotting or blockage of the catheter lumen?
It does. And remember to clamp off any lumen of these devices that is not in use to prevent air from entering the catheter.
Because that can cause an air embolism, right?
Correct. It's also very, very important to use sterile technique when caring for and using these devices, all right?
Okay.
Now remember, Grosjean catheters do not require the use of clamps or heparin because of their special design. Okay, Jeannie, why don't we go see your first patient?
Okay.
And I'll catch up with you two shortly, okay?
Sounds
Okay.
good.
Thank you.
See you guys. Oh, maybe you can wipe that again for me. I know, it's sticky.
That wasn't my mess.
Yeah, right.
Okay, good.
Well, my patient has a multi-lumen, non-tunneled central venous catheter. The CVAD dressings are changed on predetermined dates and at the nurse's discretion. Today is the assigned day to change the dressing, so are you able to help me now?
Of course. Now, why do you think this patient might have this specific CVAD?
Well, her peripheral sites are not suitable for IV access, and she's receiving multiple antibiotics and nutrition intravenously.
Right. The multi-lumen lets us give her several therapies at the same time, regardless of compatibility. What else can the catheter be used for, Jeannie?
Drawing blood samples?
That's right. And eliminating additional percutaneous needle sticks, which is more comfortable for the patient. So let's review the patient record to see if there's any sensitivity to the antimicrobial agent or adhesives, and we'll gather our supplies, okay?
Okay. Hi, Miss Gitlin.
Hi.
This is Miss Swenson, my instructor.
Hello.
Hello. We'd like to change the dressing on your IV site. Would that be okay?
Of course.
Do you happen to have any allergies?
Rodents.
Excuse me?
Little animals that are kept in cages like gerbils, ferrets, hamsters. My eyes water up. And
I don't think that's going to be a problem.
Okay.
Okay. Can I just check your ID band? All right. Can you tell me your full name?
Sandy Gitlin.
Okay. I'm going to turn off the flow of fluids to the CVAD. And I'll put the side rail down. Okay, and I'll open up the supplies. I'm going to start by putting this waterproof pad underneath of you, just in case I drip a bit. Okay. I'll be putting on my mask. Could you turn your head away from the IV for me? Okay. Now I'm going to stabilize the catheter and anchor the skin with one hand while I loosen the edges of the dressing. Doesn't hurt at all, does it, Miss Gitlin?
No.
Be sure to note the length of the exposed catheter, Jeannie, okay?
Okay, everything looks good here, Miss Gitlin. There are no signs of infection or complications. Sutures are intact. Everything looks good. I'll make some space here to open up my sterile gloves. Now I'll cleanse the catheter with the alcohol swab.
You want to move from the insertion site towards the IV tubing. Avoid manipulating the catheter, Jeannie.
Moving from clean to dirty. Now for the antimicrobial. I'm going to scrub a 2-inch radius of the skin around the catheter insertion site.
Scrub the insertion site in a circular motion, scrubbing for 30 seconds. Then you'll move out for 30 seconds again.
Okay, and I'll let that dry. Now apply a skin barrier about 1 inch away from the insertion site. Okay, and I'll let that dry. Now I can go ahead and put on the transparent dressing and center it over the insertion site.
Now be sure to secure the tubing or lumens to prevent tugging on the insertion site, okay?
Okay, and I'm going to label my dressing, right?
Yes, with the date, time, and your initials.
Okay, Mrs. Gitlin, the next thing we need to do is change the injection caps on the catheter lumens.
Sounds good.
Okay, just keep your head turned away still. Oh, thank you, Miss Swenson. I'm going to put this gauze right underneath the connection.
Check the clamp on the catheter lumen to make sure it's closed, Jeannie.
Okay. Oh, this one's open. That's where my IV line was going in. Okay, I'll start with the blue. I'm going to open up all of these and put them right on the sterile field. Now I remove the injection cap, taking care not to contaminate the catheter hub. I'll clean it and put on a new injection cap. And clean that as well.
Great job.
Thanks. Now I'll get my flush of normal saline, insert it, unclamp, and inject the saline.
Remove the syringe and close the clamp, and just repeat this procedure for each lumen of the catheter.
Now I'll be sure to document the procedure.
Thank you. Nice job. Thanks again, Miss Gitlin.
Thank you.
I'm just going to clean up here, okay?
Okay.
You're all set.
Miss Winston, do you have a minute?
Sure, what's up?
The patient I have has an implanted port, which was deaccessed yesterday when she was supposed to be going home. And then unfortunately last night she had a temperature elevation, so now she's not going to be discharged. And I was wondering if you could help me with reaccessing her port.
Sure. Let's gather our supplies and go see the patient.
Okay, thanks.
Miss Lafari?
Hi, Miss Lepari. This is my instructor, Miss Swenson.
Hello.
She'll be observing for a little bit today, if that's okay with you.
That's fine.
Okay, can you tell me your name?
Rosemary Lapari.
Okay. All right. I'd like to access your port so I can give you your medication. You take a 3/4 inch needle.
That's
right?
correct.
Okay. Have you been having any trouble with the port at all?
No problems.
Okay, good. Okay, so I'll just set up here. Okay, let me undo your gown here.
Thank you.
You're welcome. Okay, now can you turn your head that way? So now I attach the needleless injection cap to the end of the extension tubing, connect it, and then I take the normal saline syringe that's pre-filled and prime the tubing with the normal saline.
Okay.
And then I cleanse over the port site with the antimicrobial. I go in a circular motion for 30 seconds and then move out in a circular motion for 30 more seconds.
Exactly. Okay, now you need to locate the port septum by palpation. With your non-dominant hand, hold the port stable while keeping the skin taut.
Okay.
Now the key is to visualize the center of the port.
Okay, got it.
Now you're going to push the non-coring needle firmly through at a 90-degree angle to the skin and into the portal septum.
Okay.
The needle should hit the back of the port septum, Anna.
Okay. I got it. All right. Now I cleanse the injection cap with the alcohol. Insert the syringe containing normal saline. Unclamp the tubing. Flush with 3 to 5 cc's of normal saline.
Now be sure to look for fluid leaks or infiltration in the surrounding tissue. The port should flush easily and without resistance, okay?
So now I aspirate on the plunger to check for blood return. And then I flush with the remainder of the saline.
Okay, now clamp the catheter, remove the syringe, and attach the heparin-filled syringe. Then flush. Remove the syringe and clamp. Now you want to apply skin barrier, starting 1 inch away from the insertion site. So you cover the area of the dressing and let that dry, Anna. Nice job.
Okay, let that dry. So now I apply the steri strips in a star pattern to secure the needle in place. And now I apply the occlusive dressing.
Okay, Anna, you'll want to label that.
All right, so let's get you back together here. You okay?
Yes, I am. Thank you.
You're welcome.
That's fine.
That's good. All righty.
Thank you, Ms. Lipari.
Thank you.
Nice job, Anna.
Thank you.
My patient is being treated for osteomyelitis of her foot, so she'll be on IV antibiotics for a few more weeks. She has a peripherally inserted central catheter for her medications.
Okay, Robert, just remember that an important nursing intervention is to flush with saline and heparin after each use to maintain patency when it's being used intermittently.
Okay, sounds good. I'll go get the supplies.
Okay, I'll meet you in her room.
A 9-year-old Metro woman with a new lease on life.
Hi, Mrs. Hardigan.
Tracy,
It's my instructor, Ms. Swenson.
Hello.
Your antibiotic infusion is finished, so we're going to disconnect it and flush your catheter. All right?
Of course.
Okay, let me take a look at your ID band. Can you tell me your name?
Barbara Harding.
Great, thank you very much. All right. I'm just going to cap your infusion line. Now I'll just take an alcohol wipe and swab the excess cap. And insert the saline syringe into the catheter port and flush the catheter using steady pressure. And remove.
And remove. Now with the heparin, same thing.
Okay. There we go, all set.
Well done, Robert. Thank you, Mrs. Hardigan.
Anytime.
I'll just stay here and clean up. That wasn't too bad, right?
Right.
I just got word that my patient is cleared to leave now. So she won't be receiving any treatment through her port in the near future. So I was hoping you could help me with deaccessing her port.
Of course. Let's go do that.
Okay, thanks. Hi, we're back. Hello again, Mrs. Lipari. I'm going to take the needle out of your port so you can go home.
That's great.
Yeah. Okay, can I just check your ID? You tell me your name?
Rosemary Lipari.
Okay, so let's get these dressing off. You excited about going home?
Yes, I am.
Good. You might want to turn your head just a little bit. Almost got it. Hang on. Okay. So I cleanse the injection cap. Thanks. And I insert the pre-filled normal saline syringe. Unclamp the tubing and flush with a minimum of 10 cc's of normal saline. And I flush with 5 cc's of heparin, which is 100 units per milliliter. Okay, I remove this syringe and then clamp the tubing.
Secure the port on either side with the fingers, Anna.
Okay, and with the other hand, I grasp the needle and firmly and smoothly pull the needle straight up at a 90-degree angle from the skin and remove it from the septum.
Now apply gentle pressure with the gauze at the insertion site.
Now I don't need to put a dressing over the port after this, do I?
That's right. The skin is intact and serves as a barrier. If you see any blood when you remove the needle, just apply a Band-Aid.
Okay. Okay, Mrs. Lipari, you can take the Band-Aid off after a few hours. Okay.
Thank you so much, Anna.
You're welcome.
Now be sure to document the procedure according to policy, including the condition of the site and the date and time of removal.
Okay. You doing all right?
Yes, I am.
Okay, so I'll get this out of the way so you can be on your way. Okay?
Thank you, Mrs. Lipari.
Thank you very much.
Ms. Swenson.
Hi, Robert.
Hi. I'll be performing an assessment on my patient's PIC.
Okay, let's head over. We need to pay close attention to the PIC for signs and symptoms of complications.
Right. Early detection of problems prevents serious complications.
Exactly. Let's go.
Hi, Mrs. Copperthwaite.
Hi.
I'm Robert, the nursing student, and this is my instructor, Miss Swenson.
Hi.
I'm here to take care of you today. How are you?
I'm feeling all right.
That's good to hear. Now, we're here to take a look at your intravenous catheter. Is it right to do that now?
Of course.
Okay, let me take a look at your ID band, okay? Can you tell me your name?
Suzanne Copperthwaite.
Okay. Let me put on my gloves. And let me take a look at your site. Now, the dressing looks intact and adheres to the skin around all the edges. And there's no sign of leakage of IV solution or blood through the dressing. Now, through the transparent dressing, I'll be looking for redness, swelling, odor, drainage, or discomfort.
What does that mean?
Oh, those are signs and symptoms of infection.
Ouch.
Yeah. Okay. Let me note the length of the exposed catheter. All right. About 6.5 centimeters. Great. Now let me know if you feel any discomfort around the site, okay?
Okay. It feels all right.
Okay, good. Things look good. Now we'll check up on you later on, all right?
Okay, thank you.
See you later. You're welcome. Take care.
Thank you. Bye-bye. So we'll get the resembly discharged as quickly as we can, okay?
Yeah, sure.
All right. Thank you so much.
No problem.
Miss Swenson, hi. I need to obtain laboratory studies to check my patient's electrolyte level. She has a multi-lumen, non-tunneled central venous catheter. Can you observe?
Of course. Why don't we confirm the order for lab tests and gather your supplies, okay?
Okay.
Great. Lead the way.
Hi again, Miss Gitlin.
Hi.
Your doctor's ordered some lab tests for you. I'd like to draw them through your intravenous. Is that okay?
No finger stick?
No.
Oh, then be my guest. I really hate that finger stick.
Okay. First, I'm going to check your ID bracelet. And can you tell me your full name, please?
Sandy Gitlin.
Okay, Miss Gitlin. I'm going to turn off the flow of fluids to the CVAD. Raise you up a little bit. I'm supposed to wait 1 minute, right?
It depends on the facility policy. You should wait 1 minute for standard IV solutions, but up to 5 minutes for total parenteral nutrition, heparin, or any other solution that might alter a lab result.
Okay, we'll wait 1 minute then. I'll pull out my supplies while we're waiting. My heparin. saline flushes. Can I unsnap one snap on your gown?
Now, Jeannie, if more than one lumen is present, draw the blood samples from the proximal lumen if possible.
This white one is the proximal one. I'll cleanse the injection cap and let that dry. Now I'll unclamp the line and insert my 5 to 10 cc's of flushing solution, normal saline in this case. And I'll clamp the line again.
Good. And place the Vacutainer adapter with the needleless cannula into the injection cap.
Okay.
And unclamp the lumen.
Insert the discard tube and snap it in place.
Good. And fill the tube with a minimum of 5 cc's of blood. Remove the discard tube from the sleeve and quickly insert and fill the desired collecting tube.
Now I'll clamp the line, remove the Vacutainer, and flush. First with normal saline. Then with heparin.
Good. What type of catheter doesn't require a heparin flush?
Grosjean.
Wow. Very good, Jeannie.
Okay, now I'll just label my tube.
Nicely done. Thank you, Miss Gitlin.
Now I'll just clean you up. You're all set.
Thanks, Jeannie.
You're welcome. Just ring if you need anything.
Will do.
See you later, Miss Gitlin.
Bye, Jeannie.
What time's your clinical tomorrow?
At 7.
Okay, everybody. Good job today. Before we leave, does anybody have any questions about anything?
Well, Miss Munson, what do you do when you're performing a routine flush for an implanted port and you meet resistance?
So what you're saying is you're unable to push the plunger of the syringe to flush the device?
Exactly.
Well, first, push down on the access needle. And again, try gently to flush.
And if it's still too hard?
Well, if you're still unsuccessful, ask the patient to perform a Valsalva maneuver.
Can you, like, take a breath and kind of bear down? Yeah. Come on, try again.
And then repeat.
And
If that's not working, then ask the patient to change position, raise their arm on the side with the port, or raise or lower the head of the bed.
Okay, and if?
You may have to try one or all of these maneuvers. Repeat the attempt to gently flush the port.
Okay, and if you're still unable to flush?
Depending on facility policy, you could remove the access needle and re-access the port using a new needle, check for a blood return, and attempt to flush. Otherwise, you should notify the primary care provider. Be sure to document the problem and your interventions in the patient's record according to facility policy. Anything else?
I have something. You're drawing blood from a CVAD, and after you put the collection tube to the Vacutainer, you notice that the blood flow is really slow, or it stops. What should you do?
Well, first, try a new specimen tube. Sometimes some of the tubes are defective. And if that doesn't help the flow, clamp the tubing, remove the tube in the Vacutainer, flush the lumen with 5 cc's of saline solution, redraw a waste sample, and attempt to finish collecting the required blood samples.
Okay. Or you could also have the patient change position, right? Have him raise his or her arms or cough.
Exactly. And before Robert asks, if you're still unsuccessful, clamp the tubing, remove the Vacutainer and collection tube, flush the lumen, and clamp the tubing. Notify the primary care provider of your actions, as always.
And document the problem and your interventions in the patient's record.
Yes, Robert. Very good. Anything else for today? No?
Nope. All set.
Great. You guys have a good night then, and I will see you tomorrow.
See you tomorrow.
Okay.
I'll stay and help you clean up, Jane.
Well, you guys are...
I'll get that.
Thank you, Julie. Have a good evening.
All right, you too.
Bye-bye.